Hello everyone. Today we'll be starting about the urinary tract infection. Urinary tract infection and treating agents. We know very well urinary tract infection or UTI is a very important term. Is an infection of any part of your urinary system which includes kidney, bladder, ureterus, and urethra. So which causes due to the different infection from the public toilets, unhygienic lifestyle, and different foods and different waterborne disease, water pathogen like this. So this infection generally caused by the E. coli and different fungi and different bacteria also causes this disease. And if we say based on the location, there are three types of UTI depending upon the body's different part, like which is cystic or lower UTI that is occurring in the bladder. Symptoms from a lower urinary tract infection include pain with urination, frequent urination, and feeling the need to urinate despite of having an empty bladder. Though you have urinated and your urethra or uterus is empty, but you are feeling urinated. You must also have the lower belly plane and cloudy or bloody urine. Next, coming to pyelonephritis or upper UTI. This can cause fever, chills, nausea, vomiting, and pain in your upper or back side of the kidney or the spinal cord. Okay. Next, urethra. This can cause a discharge and burning when you pee, and burning sensation. And whenever you are urinating, it can cause some burning sensation. Now, what are the causative agents? The most common cause of infection is Escherichia coli. Through other bacteria and fungi may cause the disease. Now, going to the drugs for the UTI. There are urinary antiseptics, now urinary analgesic and antimicrobial agents. So mostly antimicrobial agents are classified. So urinary antiseptic like AMA antimicrobial agents, that's at an antibacterial concentration only in urine with little or no systemic antibacterial effect, that is nitrofurantoin, methanamine. These are the important drugs for the antiseptic. Now urinary analgesic like phenoxypyridine, this is one of the drug. Now, most importantly, antimicrobial agents should be used like quinolone, norfloxacin, ciprofloxacin, ofloxacin, cephalosporin, cephalexin, cefodoxime, clotrimazole, and amoxicillin. Now coming to the treatment, the antimicrobial regimen for the acute UTI is like for 3 to 5 days you have to give an oral drug. Like norfloxacin you have to give 400 mg 12 hourly, ciprofloxacin 250 to 500 mg 12 hourly, ofloxacin 200 to 400 mg 12 hourly, and ofloxacin same. Uh, Clotrimazole 960 mg 12 hourly, but I don't think so. Clotrimazole can be given oral drug. It can be given the ointment like, and cephalexin 250 to 500 mg 6 hourly. Next, cefodoxime, that is proxetil, which have been given 200 mg 12 hourly. Amoxicillin clavulanic acid 500 plus 120, that is 625 mg per day per 8 hours. Nitrofurantoin 50 mg to 8 hourly or 100 mg to 12 hourly 5 to 7 days. For upper UTI polynephritis, the range may be given 2 to 3 weeks, and nitrofurantoin is not suitable for pyelonephritis. Quinolone. These are the synthetic antimicrobial having quinolone structure that is active primarily against gram-negative bacteria, and though the newer fluorinated compounds also inhibit the gram-positive ones. See, this is the quinolone drug where fluorine may be added. Then first generation quinolone, and there are second generation quinolone, fluoroquinolone. Now coming to the first generation quinolone, that is known as the nalidixic acid. This is the basic quinolone ring, where is one benzene ring is one is pyridine, and that is introduced in the 1960, has usefulness limited to urinary tract and GI tract infection because of low potency. Modest blast and tissue levels can be invaded, restricted spectrum and high frequency of bacterial resistant. So that's why they have limited antibacterial spectrum like nalidixic acid, miloxicam, and oxolinic acid, bipyridinic acid, prosuccessin. These drugs can be given. Next, as they have resistance, that's why second generation drug will be given. That is fluoroquinolone. A breakthrough was achieved in the year 1980s by fluorination of the quinolone structure at position 6 and introduction of piperazine substitution at position 7, resulting in derivative called the fluoroquinolone with high potency, expanded spectrum, slow development, resistant, better tissue penetration, and good tolerability. This is the SR of quinolone. where different modification of the drug can cause drug changes. Increase the gram positive activity, increase the gram negative activity in case of R5. If this numbering is R1, R2, R3, R4, R5, R1, R3, R4, R5, R6, R7, R8. These are the different substitution. In case of R1, increase overall potency, like alkyl substitution can increase the overall increase potency at the R5. Increase gram positive activity if fluorine is substituted. Increase the gram negative activity at the fluorine at the R6 position. At the R7, if there is nitrogen contained ring, that will increase the gram negative gram positive activity. At the R8, increase the activity of anaerobe and gram positive bacteria. Fluorine, chlorine, methoxy, and CHF2 group can increase the activity also. The essay has been described here fully. Now coming to the ciprofloxacin drug, which is important quinolone, and their synthesis is important. That will be discussed in your class. That you can follow from here. Norfloxacin, one of the important drug. UTI and prostatitis caused by E. coli and gastroenteritis. Ofloxacin. This is one of the important drug for lower and upper UTI, lower RTI. Also is treatment of also acute pelvic diseases. Levofloxacin and ciprofloxacin, these are the modern drugs which can be used for the different UTI, RTI, bronchitis and bacterial infection also. Modified drug, gatifloxacin, one of the important drug that is also having oral drug but having antifungal action in the eye, and it can be used for the eye oral drug also, but used in the oral formulation for the urinary tract texture also. Moxifloxacin, one of the important, that is also available in the oral form. So another medicinal compound, furazolidine, nitrofurantoin. This is another type of compound which is 5-member nitrogen and furan containing compound with nitrofuran. Important drug, very effective. Now methanamine, that is like hexamine. These were the drugs used for the urinary tract infection, and you have to study the structure very well. Thank you very much.